Yes, that's right. Thank you. The prizes would be great. Hi everyone, welcome to our channel. I'm Dr Bolu Eso and this is our how-to series, and today's episode is how to help your dog with diarrhea. And today joining me to discuss the topic is George. Good boy. Can anyone guess what kind of breed my dear friend George is? If you can, enter your guesses into the comments below and a winner will be picked from the pool of the correct answers. Isn't that right, George? Yes. Diarrhea is one of the most common things that I see in the practice day to day. Why dogs get diarrhea can happen for a number of different reasons. One of them being food intolerances, so a change in food, new food, excessive treats. The other thing could be parasites, bacteria and viruses that they can pick up from the environment. Also, spoilt food is a big thing that can cause diarrhea. Not only that, but you can also have pancreatitis, hormonal issues, and allergies and hypersensitivities, which can all cause diarrhea and runny stools. Best way to prevent diarrhea could be to gradually introduce new food into their diet. So when you have a new food and you're trying to get them to eat something different, gradually transition the food over a certain period of time. This could be 10 days to 14 days. And what I tend to say is stage the diet in. So that could be 100% of the old food, then 80 to 20% of the old to new food, 70-30, 60-40, 50-50, etc. And that means that they don't transition abruptly and cause diarrhea. The best thing you can do is introduce low-fat and easily digestible foods into their diet. This could be white meat such as lean chicken, lean turkey or white fish, and also your starchy foods such as rice, pasta, carbohydrates such as potatoes also helps. The other thing you can do is make sure you give them fresh water and make sure they're easily accessible to water as well, because you want to keep them hydrated as they lose a lot of fluids when they're passing the diarrhea. Also, when they have diarrhea, you might want to introduce prebiotics or probiotics. Now, what a prebiotic is that it's the bacteria, and that's the good bacteria, to help rearrange the gut flora. Often when they get diarrhea, the gut flora becomes unbalanced, and because of the imbalance, they get the diarrhea. So when you add the prebiotics to the diet, that is all the good bacteria to help their stomach bounce back and give them healthy gut poop again. Aside from that, you want to look out for things like kaolin. Kaolin is something that's inside a lot of prebiotics and probiotics, which helps bind the feces and stops it from being so runny. The best place to get them is the vet practice. So you can drop by your vets and usually they're easily dispensed and over the counter, and it helps with diarrhea straight away. So what does diarrhea look like? The best way to identify diarrhea is a stool chart. Usually at the lower end of the scale, 4, 5 and 6 tends to be diarrhea. So if the poo looks like this rather than this, then it's more likely that your dog has diarrhea. So in some cases, diarrhea can become chronic. And by chronic, I mean more than 3 weeks. Not to be alarmed straight away, but if you do notice that it's been going on for a long time, the best thing to do is to contact your vet. This could mean that we might need to do additional tests just to rule out whether or not the diarrhea is caused by something else. So this could mean poop tests or blood tests just to see what else is going on in the body. The best time to call the vet is when your dog looks down in the dumps, they seem quite flat. If they've had the diarrhea for longer than 3 days and it's not shown any sign of improvement. Also, if the diarrhea is accompanied by vomiting, would be a good time to contact your vet. But often if you see vomiting and it's not productive, or your dog seems to just be retching without producing actual vomiters, then that could mean bloat. Bloat happens in a lot of our deeper chested dogs, so German Shepherds, Great Danes and Greyhounds, and it can often become life-threatening. And if you do notice this kind of retching and heaving, then it's better to contact your vet immediately. Another big thing to look out for would be blood in the stools. Often blood happens because of straining and sometimes because of discomfort. It's nothing to be alarmed by, but if you do notice blood, make sure you contact your vet. For most other things, Butternut Box has a vet nurse helpline, and if you log into your account, you can find the number. Thank you for joining us for this episode. We hope you enjoyed it. We have many more videos and you can check them out on the YouTube channel. Up you go. Good boy, right in there. Sit. Good lad, stay right there. Don't look at anybody else. Look only at me. You're mine. Yes, oh yeah, okay. So if the poop looks like this, I can't do that with a straight face.